You probably don't need psychiatry to determine capacity in your patient. There are 4 general tenets of capacity, and here's the first one. Does the patient understand? Now, they're not going to know the ins and outs of everything, but on a basic level, do they understand? I have appendicitis. It is treated with antibiotics and surgery. It is an infection in my belly. Basic stuff. Are they able to retain the information that you're talking about? Meaning, at the end of the conversation or halfway through, are you like, hey, can you just summarize what we're talking about? Oh, doctor, we're talking about my appendicitis, this infection in my belly, that you're telling me needs to be treated with antibiotics and surgery. Something like that. Way tends to be the more tricky one. We'll get to that in a second, but they communicate a preference, right? Doctor, I would prefer not to have surgery for my appendicitis. I am okay with antibiotics, but I want to go home. I have to let my dog out. Whatever. The 4th pillar of weighing is a little more complicated because you need to determine, does the patient reasonably understand the decision that they're making and the consequences of that decision? And they would say, hey doc, I understand you want to do this surgery. The surgery could save my life, but I'm terrified of surgery. I would like to give it a pass for a day or 2 with antibiotics and see if I get better. I'll follow up with my primary. I have a loved one at home who will call on my behalf if I don't get better. They can say reasonable things for what we would think is an objectively poor decision. But people are well within their rights to make poor decisions. You just need to make sure that they are informed in doing so. And people are able to communicate this in a variety of ways. It can be written, it can be verbal, it can be gestures, it can be definitive yes or no, right? Another option is think of your COPDer who's 85 years old, who's on BiPAP, and you're thinking about intubating them. We often don't think very much about, hey, here are the risks and benefits of intubating. You might never get off the ventilator. You could improve. I can't see the future, unfortunately. Is that something you would want? The same principle applies. Do they understand how sick they are? Are they able to retain the conversation that you're having with them? I have COPD. I'm critically ill. Are they able to weigh the risks and benefits? The benefit of ventilation is it's a more definitive airway where they might improve. It's more easily manipulated. But the risk of that is also pretty high. You could be on a ventilator and maybe never get off. Is that something you would want for yourself? What does it mean to be alive? Is that part of living for you if it's on a ventilator for the rest of your life? It gets tricky given how conspiratorial people can be. Do they refuse blood products because they're a Jehovah's Witness? Or because they think that I profit from big pharma from putting COVID antibodies in the blood? Where do you draw the line? There is a place for psychiatry in this, but it does not start with me, doctor, you patient, you don't agree.